I'm pleased to have as my guest Todd McDonald from Aisling Partners. And Todd, welcome to the show.
Thank you, Tim. Great to be here.
It seems like on a day-to-day basis, we're talking about healthcare nationally, in Washington, D.C., at the state level, at the local level, and people at the kitchen tables. And you're going to solve all the problems for us and answer all the questions that people have in the 8-minute segment that we've got. But
Not an issue.
Welcome to the show.
Thank you.
So Todd, just so as we get into this a little bit, people have insurance primarily through their employers. Mm-hmm. They select, or the employer selects, an insurance company that they might use. They have that insurance company, and then it works with hospitals, and then hospitals work with doctors or provider groups. So the role that Aisling Partners plays in all of that, 80% of our chamber member businesses are small, medium-sized businesses, primarily small. They're trying to make the widgets, deliver the services, the product. They don't necessarily have time to figure out what's changing on a day-to-day basis in healthcare. So where do you come in?
No, it's a great question. So, our role is one of advice and guidance. And I think, you raised the valid point of the complexities of healthcare and what I would call the stakeholders involved. And the reality is, as an employer, they need advice and guidance and counsel. And ultimately, that's our role. So we decode what I would call the world of healthcare spaghetti and really try and provide that advice and guidance and really kind of lead them as to, what is out there for solutions and opportunities, what types of complexities and pitfalls should they be mindful of. And it's not something they should try on their own. We live and breathe this every day. We work diligently and hard to understand it ourselves.
Right.
We partner at the highest levels with the health insurance companies. I sit on the state association board, so we drive policy. So my recommendation, if you will, would be to make sure that they have a resource, whether it's a firm like ours or another qualified firm, some industry associations, and maybe a confluence of all of them, because it's a slippery slope.
Yeah, and if you're somebody who's not kind of involved in a day-to-day basis, I think the national average, I think 83% of the people nationally are now insured, and the Commonwealth of Massachusetts is 97% plus. I think most people would say that's a good thing. If people have access to health care, they're more likely to go see a doc, preventative care, and not breaking the bank, for people individually. That being said, and we're hearing it from our chamber member businesses, you're hearing it from the people you work with, double-digit increases or 8, 9, 10% increases every year, it's just not a sustainable model.
It's not, and the challenge continues. We have a new administration which is going to, again, provide another level of complexity and learning and so forth. We need to collectively work harder at this, and I think a lot of the focus has been on what I call the 10% rule. So 90% of every dollar paid to healthcare by an employer goes towards their claims, 10% towards administration and overhead. And I think a lot of the focus has been on that 10%. I think if we can turn that focus to the 90% and really understand, health care is expensive, therefore health insurance itself and the corresponding premiums are expensive. And, what's driving that? And I think we know it intuitively, but getting at that. So the waste, the oversubscription, and quite frankly, a lot of what we work on as a firm with our clients is really education and communication, so they understand, they can ask the questions and so forth.
So you mentioned education and communication, and we're going to plug, and I joked at the beginning in 8 minutes, you're going to explain all the healthcare intricacies and complexities of it. But on March 7th at 8:30 at the Chamber, we're going to host a seminar series about this very issue and allow our chamber member businesses. And if you're not a chamber member business and are interested in coming, we'd love to talk to you about that and maybe have you come as a guest to understand what the chamber does and the different ways that we help our businesses. But we're going to have a fuller conversation and allow people to ask questions. But let me just ask you, you mentioned the Affordable Care Act has been repealed, I guess, legally, but no replacement, or it's in place until a replacement is.
I think we're in a freeze mode, but yes.
The state is trying to work on that as well. But as we talk about kind of from a business, and what are the things that they could be doing, cost containment, what are the menus? As you sit down with a business, maybe you could just walk through what you do when they engage with you.
Happy to do that. And just back to the March 7th, again, I'd recommend any employer to attend. What we'll do is we'll take a retrospective look at really what we called Romney Care in Massachusetts back in '06, the implications of that, how the Affordable Care Act has since layered in on that, and then we will get into your exact question, which are what are the tools and strategies? We sit down with our client to understand what are their goals and objectives as it relates to their employee benefits at large. Specific to healthcare, which is oftentimes the elephant in the room, we talk about different funding strategies, different ways to look at healthcare, to purchase it, to acquire it. There's spectrum in that you could be fully insured or self-funded or some creative kind of advanced funding in between. We're seeing a movement towards companies really bundling together in things called captives, which are really offshore arrangements. You don't think of that when I'm a 20, 30 person group, but as healthcare has become more expensive, as the complexities have continued to become more aggressive, we're looking at things like that. But day to day, are the employers looking at consumer-driven health plan? Are they engaging the employees with higher deductibles? Are they giving the appropriate incentives, both in terms of premiums, as well as support towards some of those directives? For example, a case we were working on yesterday for a client, they have a high deductible plan, and every employee will get a Fitbit, and that Fitbit will track their movement, and for every certain number of paces, the employer will put money into their health savings account.
Wow.
Such that they are motivated to maximize that. Absolutely. So we're starting to really trigger and see a lot of these kind of integrated solutions. But at the core, there are just baseline things that companies can do, looking at, again, their plans, their products, their contribution strategy. And I think one of the greatest areas right now that we spend a lot of time on as a firm is compliance, because it's become very tricky, it's become burdensome. And so if we can, as a firm, really focus on their health plans, their education, their communication, the engagement tools, the compliance piece of it, and then just wrap that all around, making sure that all parties and stakeholders involved are engaged. So it's really about that. I got in the business 25 years ago when we used to talk about product and rates.
Right.
And now we're talking about payroll, HR, benefits, and product all intersecting. And it's really become a complex world, and technology is a big player in this now.
And you mentioned compliance. I mean, there's a proposal that just was rolled out at the State House. Now it's the beginning of a conversation that employers potentially who don't have access to, are not utilizing health insurance could be hit with a $2,000 employee fee.
That's exactly right. Kind of the fair share coming back to Massachusetts.
The fair share coming back, and that was something, you mentioned Romney Care. We started that. Governor Patrick implemented it. It was passed. We implemented it in 2007, and there was about a $300, $400, I think it was, employer assessment.
Correct.
Now we're talking about $2,000, and that's got people's attention.
And it should. And as an employer, watching the increase in rates, watching these complexities at both the federal level and the state level, back to your original question, what is the role a firm like ours plays? It's to walk them through this. It's to guide them. It's to lead them. It's really to be kind of their thought leader surrounding benefits. And without this, I think companies are exposed.
Absolutely. And you've been working with the Chamber for a long time.
I have
to help the Chamber, I know that.
Absolutely.
So March 7th, but
yes.
If people want to get in touch, we just got a moment or two left, but people in the interim want to get in touch with you, Todd, what's the best way to get in touch?
Our firm is Aisling Partners, as you said. We're at 25 Harvard Street in Worcester. Phone number is 508-799-9100.
Beautifully restored brick building on historic Harvard Street.
That's exactly right. Happy to be there. And again, March 7th, we're looking forward to it. I think it's a wonderful thing the Chamber's doing. We're delighted to be a participant in that. And after our sector, if you will, of that, the insurance companies will be there as well. So a nice chance to get to know your friends at Fallon and Harvard and Blue Cross. So I think a great forum to talk about, what we just solved in 8 minutes.
Good stuff.